Hello everyone, I'm Arlene Byrne from Tarlac State University College of Nursing, BSN2B. So for today, I will be performing the cold compress. For the purpose of this is to slow or to stop the bleeding and to slow the bacterial activity in the client with infections, and also it reduces the swellings and injuries of the tissues, and also including the sprains and the fractures, and also controls the pain and fluid loss in the initial treatment of the burns, and also prevent peristalsis of the clients with the abdominal inflammations, and also it prevents the escape of heat from the body by slowing circulations, and which also relieves the congestion. So for the assessment, we need to assess the following. So first, we need to identify at least two identifiers of the patients. So hello ma'am, can I see your wristag po ma'am? Ayan po. Okay po ma'am, check ko lang po ha. Okay po, tama po. And then after that is we need to refer to the healthcare providers, the order of type or locations, and also the durations of the applications. And we need also to perform the hand hygiene to remove all the microorganisms. And also we need to inspect the condition or the affected part, and we need to palpate area for the edema. So, ma'am, check lang po natin ha yung conditions po ng skin po ninyo. Tignan din po natin kung there is a presence of edema. So, wala naman po, ma'am. And then, after that is we need to ask the patient to describe the severity of the character of pain. So, ma'am, ask ko lang po, ma'am, kung gaano po, or can you describe to me po kung ano po yung, gaano po kasakit yung nararamdaman nyo ngayon? Okay po, ma'am. And then, after that is, we need to perform a neurovascular check and then inspect surrounding skin for the integrity, the circulation, the color, and also the temperature, and also the sensitivity to touch. So, assuming that we already done assessing the neurovascular, and then we now check the skin of the patient. Masakit po ba, ma'am? Ano po nararamdaman nyo kapag pinapalpate ko po siya, ma'am? Ano po, ma'am? And then, after that, we need to review the medical history for the condition that contraindicated to use a cold therapy. And then after that is we need to assess the patient's the level of comfort and also the responsiveness. So, ma'am, I will assess lang po yung level of comfort po ninyo, or yung, yes po ma'am. Kamusta po kayo, ma'am? Okay po, ma'am. And then after that is we need to assess the patients to understand and to be aware of the procedure that we will render to the patient. So, ma'am, ask ko lang po, ma'am, kung may idea po kayo kung ano po yung gagawin natin ngayon. Yes po, ma'am. Okay po. Yes po, ma'am. And then after that, for the planning, we need to identify an expected outcome, and then prepare the equipment that we will use for the procedures, and also explain the procedures and also the precautions. So, first, I will introduce myself. So, hello ma'am, magandang umaga po. Ako po yung nurse for today. I'm Arlene Brun po, and maaari ko po bang malaman yung pangalan nyo? Can I see your wristband po? Okay po, ma'am. Ask ko lang po, ma'am, kung ilang taon na po kayo? Kailan po yung birthday nyo, ma'am? Okay po. So, ma'am, gaya po ng sinabi ko kanina, or ang gagawin ko po ngayon sa inyo is magbibigay po ako sa inyo ng cold compress na kung saan is to relieve po yung or to slow the to stop the bleeding po ng inyong wounds. And also, makakatulong din po ito sa inyo para makontrol po yung pain and yung fluid loss sa initial treatment ng burns po. Okay lang po ba yun sa inyo, ma'am? Makiki-operate po ba kayo sa akin? Susundin niyo po ba yung mga instructions ko po sa inyo? Okay po, ma'am. Thank you po. And then after that, we need to provide the patient privacy, close the door and also the curtains. And then, after that, we need to perform the hand hygiene. And then after that, we need to wear the gloves. And then after that is I will be position the patient in the appropriate positions and expose area to be treated and drape the patient with blankets. So, ma'am, position ko lang po kayo, ha? Okay po, ma'am. Expose lang po natin yung area na iti-treat po natin, okay? Okay lang po ba yun sa inyo, ma'am? Comfortable po kayo sa position niyo, ma'am? And then, after that is we need to place a towel or pad under the wrist of the or under the area to be treated. So, ma'am, lagay lang po tayo ng ng pads po dito. And then after that is we need to apply cold compress and place ice water in the basin and test the temperature. So assuming that this is a cold water, and then I will put the cold water in the basin. And then I'll be tetest ko siya kung okay ba yung temperature niya. Okay? And then, after that is, submerge gauze into the basin and wrung out the excess moisture. So, I will put the basin in the, I will put the sterile gauze in the basin. And then, after that is apply compress to the affected area and mold over the site. So, mamalagay lang po natin, ha? Kumusta po yung temperature nyo, ma'am? Okay naman po? So, and then after that is remove and remoisten and reapply and to maintain the temperature as needed. So, ma'am, alisin lang po natin, ha? And then, a-apply po natin ulit. Kamusta po yung ulit yung temperature, ma'am? Okay naman po? Okay po. And then, after that is, we need to apply the ice pack or the bag. So, assuming that this is a perfect equipment for the ice pack or the bag, and then fill the bag with water and secure the cuff, invert the bag. So, I will fill it with water. Then I will open it and then put water in the basin and then I will cover it. And then after that is I will be empty the water. I've done with that, and express excess air from the bag and secure the bag, the closure it, and then dry it. So using the any or the blanket or towel, you can dry it. And then after that is you can squeeze or need commercial ice pack. So I will squeeze it rather in the basin, and then I will wrap the pack or the bag with a towel and apply over injury and secure with the tape as needed. So I will be wrap the pack or the bag with towel. So I will wrap it. And then I will apply to the injury. You can use a towel or it is optional only when or you if you want to use a towel. And then after that is apply commercial gel pack and then remove the from the freezer and wrap it in the towel and apply over the injury and then secure with tape or the gauze as needed. So I will be pack the or remove from the freezer, assuming that I will remove it from the freezer and I will wrap into the towel and apply to the injury and secure it with the tape or the gauze. Assuming that this is a commercial gel pack, and then I will put it into the area. And then after that, apply the electrical control device and then prepare the device appropriately. So we need to prepare the device. Assuming or let's pretend that this is a perfect device for the electrical control device, and after that is we need to ensure all the connections are intact and the temperature is set. So check lang natin yung connection niya if it is intact, the temperatures. And then after that is we need to wrap the cool or water flow pads in the towel or the pillowcase. So assuming that we will we've done wrapping the cool water flow in the pads or in the towel, and then after that we need to wrap the cool pad into the around the body parts of the patient. So, ma'am, lalagay lang po natin, ha? And then, after that is we need to turn the device on and set the correct temperature. So, ma'am, i-on ko na po yung device natin, ha? And then, isi-set ko na po yung appropriate temperature para po sa inyo. Okay po? And then, after that is we need to secure with the elastic wrap and the bandage or the gauze or roll it or ties. And then after that, you need to remove the gloves and dispose all the materials or equipment used, and then perform a hand hygiene to remove all the microorganisms. And then after that, we need to check the condition of the skin for the appropriate intervals. So, check lang po natin, ma'am. And then after that is we need to use extra caution if area was edematous and assess the site more often. And then stop if a patient is complain of burning sensation or the skin is began to feel numb. And then after that, for the we need to apply the clean gloves and then remove the compress or the pad at the appropriate time and dry it in any moisturizer. So I will put my clean gloves. And then after that is to I will be going to remove the compress. So, ma'am, alisin lang po natin, ha? And then dispose it. And then after that is we need to use some moisturizer to dry the area. So, assuming that I will be using to dry the area and then dispose it. And then after that is I will be help the patient into the comfortable position. So, alisin ko na po ito, ma'am, ha? So, ma'am, are you comfortable in that position po? Okay po, ma'am. And then, after that is, I will remove and dispose all the equipments and materials that I use in these procedures. So, first, I will be removing my gloves. And then, I will be performing the hand hygiene. And then, I will be empty the basin, assuming that I already empty the basin. And then, after that, for the evaluation is we need to inspect the affected area for the integrity, the color, the temperature, and the sensitivity to touch, and also the reevaluate at the appropriate interval. So, ma'am, check lang po natin, ha? Okay po, ma'am. Kamusta po, ma'am? Sakit po ba? Okay po, ma'am. And then, after that is palpate affected area for the edema, bruisings, and also the bleeding. Ma'am, palpate lang po natin, ha? Kung meron po siyang mga edema or meron po siyang mga pasa. Okay po, ma'am. And then, after that is we need to ask the patient to report pain level. So, ma'am, ano pong nararamdaman nyo ngayon, ma'am? Okay po, ma'am. So, okay po, ma'am. Okay po. And then, after that is ask the patient to demonstrate on how to apply this procedure or the ice pack to us. So, ma'am, pwede nyo po bang i-demonstrate sa akin kung paano po i-apply yung ice pack? Yes po, ma'am. Very good po. Yes po, ma'am. Okay po, ma'am. Thank you po, ma'am. Yes po, ma'am. And then, after that is we need to identify the unexpected outcome. Okay po, ma'am. And then, for the recording and reporting, we need to record all the procedures and the patient's response in the appropriate log. So, I will be record and the procedures and to the patients. And then, document the evaluations of the patients or the caregivers. And also, we need to report any sensations of the burning, the numbness, or the unrelieved skin color and changes to the healthcare provider. And then, after that, we don't forget to perform a hand hygiene to remove all the microorganisms. So, that would be all. So, ma'am, thank you po, ma'am. Yes po, ma'am. Thank you din po, ma'am.